I started getting really sick. I had 105 fever, I had joint pain, I had neuropathy, I felt like my back was broken, I had a migraine headache. And when I was in college, I had meningitis. So I thought I had meningitis again. And I was actually on my way to the hospital or getting ready to go to the hospital. And my ex-wife had said, "Oh, what's on the back of your leg?" I can't see the back of my leg. So I did the double mirror thing and I saw a big bullseye rash on the back of my left leg. And I said, okay, well, I know what this is. So I went to urgent care. I got, prescribed antibiotics, doxycycline, which is the conventional treatment. And after 4 or 5 days of treatment, I mean, all my symptoms really went away. But for anyone who's ever opened their own business, they know what it's like. It's very stressful. At the time, I couldn't afford staff, so I was at the office 6, 7 days a week, long hours. And about 8 months into that schedule, I started to get symptoms again. Started getting joint pain, started getting neuropathy. I really felt unwell, and I felt, okay, well, this is like what I had before. Fine, doxycycline worked beautifully before. I'll just do it again. So I took a month of doxycycline, didn't touch it. Took a month of azithromycin, didn't touch it. Then I started working with a local Lyme doctor, and we were doing combinations of oral antibiotics, and did it for about almost 9 months, and was actually getting worse. The antibiotics were destroying my gut. The inflammation wasn't getting any better. My symptoms weren't improving. So I went to see a medical doctor in New York, who was also an acupuncturist, and he started treating me with Chinese herbs, and kind of also the realization that I really wasn't, eating well and sleeping well and taking care of myself. But once I kind of did all that, within about a month or so, I felt 80, 85% better. So it was my own reminder that, natural things work really well. I had kind of strayed from that because I just, being new to Connecticut, new to Lyme disease, this is what you do. And it's even what I learned in school. So it took about another 2 years to really feel like I got to a point where I was symptom free, but eventually got there. And over that 3 year haul, really learned a lot about myself and learned about how to manage Lyme. And that again, it's really not just about killing the bug. We have to look, in fact, all these other things in your life that control your immune system, that control inflammation, and of course it's diet, it's lifestyle, and many other factors. So any healthcare provider who's had their own personal experience with a health issue, gets to be an expert in it pretty quickly. And again, here we are, many years later and thousands of patients.